Hello everyone, my name is Dr. Evelyn Lucas Perry. I'm the Director of Public Policy Research for the Adea Policy Center. Adea is the acronym for the American Dental Education Association. As you can see, the title of my presentation is Your Journey Will Be More Than Just Teeth, and I'm really looking forward to explaining to you why as a dental student you're learning more about than just what's inside of the mouth. So, before I start, let me give you a little bit of background about who I am. I am a recent graduate of the University of Michigan School of Dentistry. I did my Bachelor of Science in Biology at the University of Michigan and then went straight into dental school. I graduated in 2011. After you graduate from dental school, there's basically three main options that you have. You can go straight into practice, you can practice as a dentist, or you can learn more and become more advanced in general dentistry, and you can do a residency, either a 1 or 2 year residency, or you can pursue a specialty. I chose to pursue a specialty, and all specialties are at least 2 years, and they can go all the way up to 7 years, or actually 8 years. So I chose my specialty was in dental public health, and this is a picture of where I did my specialty, which was at the National Institutes of Health. The National Institutes of Health is the nation's leading biomedical research agency, and so this is just again a picture of its campus. So many of you might not have heard of dental public health as a specialty, so can you guess how many specialties in dentistry there are? Let's see if you were close. There are 9 specialties within dentistry, and I'm not going to go into a lot of detail over all of them, but just to give you a general understanding and overview of what the specialties are. So, of course, mine is dental public health in the beautiful heart there, and that's really looking at the population health. So how do you improve the oral health of the population? And you do so through research, through policy and administration, and also by preventing disease and promoting health. Prosthodontics is another specialty within dentistry. You're dealing with a lot of full mouth rehabilitation, and so that involves dentures and implants and bridges. Periodontics, that's where you're preventing disease, or you're trying to help someone who has some type of gum disease, and so you're doing a lot of surgeries and deep cleanings and implants. Again, a lot of these specialties can also kind of overlap, and you'll see that with implants in particular. Endodontics, you're dealing with root canals. Oral surgery, you're dealing with correcting cleft lip or cleft palate. So that's a oral condition where the roof of the mouth is not completely closed, and so patients, babies, they're born with it. It's congenital defect. They're not able to eat or talk properly. And also oral surgery involves wisdom teeth extractions, cancers, and implants. Oral pathology involves diagnosing oral diseases. Many of you are familiar with orthodontics because you probably had braces. Pediatric dentistry, you're dealing with kids and special needs patients. And then radiology, that's dealing with imaging. So just to give you an overview of the dental specialties. So what is it like to go through dental school? Like I said, I'm a recent graduate, so this is all pretty new to me, dental school. It's still right in the back of my mind. So dental school is a 4-year program, except for one school, the University of Southern California, which is 3 years. And all dental schools, while they vary from school to school, they have to teach you all of the same concepts, the same competencies, and so they're pretty consistent. The first 2 years, you're really focusing on the sciences, and you're in preclinic. Preclinic is when you're not working on patients. You're practicing, you're working on how to become a better clinician before you work on patients. The last 2 years, that's when you're actually more so working on patients, and you're really honing your skills as a clinician. So, like I said, the first year and second year, but really your first year, that's when you're taking a lot of your microbiology, biochemistry, dental anatomy, your strong science, and dental foundation courses. Now you're also taking human physiology and you're learning about like the gastro system, the renal system, the nervous system. You're learning about all these different systems because remember the mouth is connected to the rest of the body. So the diseases that people get in their mouth also affects the rest of their body and vice versa. So you have to understand that as a dentist. Then you really start working in the clinic. This is the preclinic, and we call them you're practicing on mannequins. So mannequins are fake heads with fake teeth. So the student on the right that's leaning into the mannequin, she's actually doing an x-ray, a radiograph, and she's learning how to take the proper radiograph because remember, you have to capture what's going on with the teeth in order to diagnose if there's a disease or condition that's present in the radiograph. So you're learning how to do that correctly. The student in the other picture is actually doing some type of drilling. So the teeth are pretty small, and so when you're a dental student, you start to be able to decipher between the difference of a millimeter to a quarter of a millimeter. You have to be that precise when it comes to your dental skills. So your first 2 years, you're really in the lab a lot, the clinical lab, you're really in the library a lot, and then finally around your 3rd year, that's when you start heavily getting involved with patients and working with patients. Now just because you start having your own patients while you're 3rd year doesn't mean that you don't see patients at all until then. A lot of schools actually have you see patients in your 1st and 2nd year. Now you see them either by observing or being an assistant, but you're learning how to develop that rapport, patient rapport, and chair-side manner, which is so important as a dental professional. So when you first go into clinic, that's when you're starting to understand, oh my goodness, what I learned in my classes is actually very relevant to what I need to know as a professional. And then while you're in your 3rd and 4th year, that's when you're really starting to learn about the advanced clinical procedures and knowledge of dentistry. So you're learning more about root canals and you're learning about how to do braces and how to do dentures, things like that. Finally, towards the end of your 4th year, it starts to somewhat hit you and you're like, oh my goodness, I'm going to be a dentist in a couple months. And there's a lot of things that you have to do to prepare to become a dentist. After you graduate from dental school, you have to go through licensing and things like that. But really, you start to have a mental shift. You start to think of yourself as a dentist. You start to become comfortable with yourself. Your faculty members, they start having a lot more confidence in you, giving you a lot more leeway, and you really start to become a leader, and you have to really start taking ownership of your patients. Finally, you graduate, and that's the promised land. That's when it all comes together and the whew, comes out. So this is a picture of myself here and my sister who also graduated with me, and my mother who's a dentist, and my dad, of course, who is with us for graduation. A lot of you might have a parent, a sibling, an aunt or uncle, some type of family member who's a dentist, and that might have been the catalyst for why you consider dentistry as a profession. Others of you might have had a personal relationship with your dentist or a good experience or even possibly a negative experience with the dentist that made you want to pursue dentistry. Regardless, I can tell you this, when you're on those steps and they hood you as a doctor, it's the most gratifying moment for your family and for yourself. So this is a picture of the Godental webpage. I put this on here particularly because I've given you a overview of what dental school is like, but really not a day-to-day of what it's like to be a dental student. So if you actually go to www.godental.org, you can go to the DentTube site, and there Adea has done a great job of giving you diverse perspectives of dental students on what it's like in their their day-to-day on a day-to-day basis. So you'll have first-year dental students from California talking about their dental school experience to fourth-year dental students in Virginia talking about what it's like for them as a dental student. So you'll be able to hear a variety and a diverse perspectives from dental students at different age, at different points in their dental school career, but also from different dental schools. So it'll be pretty interesting to you. So back to my title of my presentation, what did I mean when I said that your journey will be more than teeth? And basically what I mean by that is that there's multiple opportunities for you while you're in dental school. Of course, first and foremost, you're learning about what it means to be a great clinician and you're learning about the field of dentistry, but there's also so much more that you learn and you can be involved with while you're a dental student. And I just want to hone in on 5 of them today. I'll talk about leadership and professionalism. I'll talk about the importance and value of mentorship. I'll talk about outreach and how you can become involved. I'll talk about the role of student organizations, and then lastly about research. So, leadership and professionalism. So this is a key component within the profession of dentistry itself, because dentistry as a profession is self-regulating, it's autonomous, and so there's a code of ethics that you assume when you become a dental professional. And so being involved in leadership activities and professional opportunities while you're a dental student is so important, because once you graduate from dental school, you're really seen as a leader within your community. So there's a lot of opportunities. So sometimes your dental school will have some type of leadership program that you can be involved with. At the University of Michigan, for instance, we had what's called SPDL, which was the Scholars Program in Dental Leadership. And that was a program that anyone could apply to, and once you applied and got accepted, you would learn about how to become a better leader, and you would learn about your strengths and weaknesses as a leader, and you would have to be involved in leadership projects and activities. It was really a great program. Some schools have this, and sometimes the dental school might not have it, but the larger university might have leadership opportunities for you to get involved with. Regardless, all dental schools have positions, have in dental student organizations and within the student council. So within a dental school, the student council is they represent on behalf of the students and the students' interests. And student organizations, there's multiple ways for you to get involved in student organizations as well. And this is an opportunity for you to learn about how to become an effective leader and also work with other students who are interested in developing their leadership capabilities. Now, sometimes you might not have a leadership opportunity or you want to just develop some type of program that's maybe not offered at your school. And again, that's an example of a student taking a leadership role. There's one example that comes to mind, and that's at the University of Illinois in Chicago. They actually some dental students got together and developed a program to help serve the underserved community in the Chicago area. They developed a clinic. It's a completely student-run dental clinic. So that's an example of how dental students got together, saw a need, and said, you know what, let's develop an opportunity for the community. And so it's an example of them really developing their leadership skills. Lastly, you can serve as a mentor. Mentorship is so important, but you yourself can develop your leadership abilities by serving as a mentor to other students. Now, this is a big component when you're a 3rd and 4th year student, because like those pictures I was showing you about working on the mannequins, you can help 1st and 2nd year students learn how to take the right x-ray or drill on the tooth correctly. But also, even as a 1st and 2nd year student, you can offer your experiences on what was effective for you to become and matriculate into dental school to other students that are trying to get into dental school. And you can also let students know about what it's like to be a dental student. So there's a lot of opportunities for you to be a mentor to others. Speaking of mentorship, that's one of the key components that's going to serve you while you're in dental school. So mentorship can come from various places. It can come from faculty members, so people teaching your classes, to administrators, to the dean of your school. Like I mentioned, it can be upperclassmen, and it can also be the alumni, of the dental school. So mentors are very important. They're important for several reasons. First, they're important for helping you while you're in dental school. They can help you um, set set goals. They can help you learn how to navigate through different problems that you might be having with the class or with a certain procedure or a patient. But also even after dental school, if you're maybe interested in a specialty, they can help you maybe navigate through how you should be involved in pursuing that specialty, or they can help you as far as maybe where you might want to practice or who you might want to practice with and what type of practice setting. So there's just a lot of different opportunities that a mentor can be able to provide for you. And really at the core of it is that that mentor will provide guidance and support. Dental school can be exhausting, and sometimes you really need that person to give you that extra nudge and support. Outreach. So outreach is a key component. Within the United States, we have such a need for access to dental services. A lot of people don't have dental insurance. A lot of people don't have access to dental providers. And so being involved in outreach is really a great way of a great activity while you're in dental school. Now, a lot of dental schools have their own school-sponsored activities. So, for instance, a dental school might have a Saturday every month or every 6 months where they will provide free dental services to the community and people that need it. Other opportunities are through international trips. So international trips, they can either be through your school, through a student organization, a faith-based organization. It really all depends. And that's a great way of learning about different cultures and also giving back to the community in that setting. So international trips can range from 1 week to a month, and they can go from anywhere from Nicaragua to China to Africa. Again, it all depends. Lastly, being involved in outreach doesn't necessarily mean that you have to go abroad, but it can be local events. So you can be involved in health fairs. So fairs can be held at either the dental school or at a community center, at a church, a synagogue. Basically, it helps the community know about why dentistry is important and why oral health is important. So you can do a lot of health education, you can do dental screenings and let people know and direct them as to how they can get dental services. Also, you can visit elementary schools, middle schools, high schools, and also teach kids about why it's important to brush and floss, and also help them consider dentistry as possible as a field for them in the future. Student organizations. Now, I've mentioned these in several of the earlier topics, but again, student organizations are a great way to get involved while you're in dental school. Now, there's multiple student organizations to be involved with. An example is Adea actually has a student organization called the Council of Students, Residents, and Fellows. Now, student organizations can range from, and they can focus on different topics like research to being involved in outreach, to having some type of dental focus. Regardless, there's a lot of organizations for you to be involved with and to really find your niche. Student organizations, they also involve meetings and conferences. While you're at these meetings and conferences, you can interact with other students from different schools, and you can also learn more about dental topics and get a more in-depth knowledge about dental topics that might have been only glanced on while you're in dental school. Also, student organizations are a great way to network. You can network, like I said, with different students from different schools, but also sometimes these conferences and meetings also involve different faculty or even professional organizations. A lot of times, a student organization will have a connection with a professional organization, meaning people that are already dentists, members that are already dentists. Also, you can learn a lot from just by being a part of a student organization. You can learn a lot from the people that are there. And then also a key component is social support. So sometimes you just need support not just in the clinic or not just with your books, but just for you just want friends, you just want to hang out with people, and that's where student organizations can really come in. Lastly, I'm going to talk about research. Now, research is so important within dentistry because research really serves as a foundation for all of the innovations, the treatments, the modalities, everything that we need as far as treating and improving oral health. So research is really important. Now in this picture I have the typical, what a lot of you might typically consider research, which is biomedical research. But just because you're not interested in biomedical research or pipetting or petri dishes, etc., doesn't mean that research isn't for you. Research can be clinical, so that can involve patients, you actually doing a clinical procedure and seeing if that's effective. It can also be public health research, which is what I do. So that can involve policy, that can involve access to care issues, it can involve health services. There's multiple topics that research can involve. So one of the things that I would recommend is that really look at your schools, once you're in school, look at the summer programs and the school research programs that are available and see if there's maybe something that you might be interested in. Summer programs also can involve, do you remember that picture that I showed you, the National Institutes of Health? They actually have summer programs and research programs that are available to dental students. When you're involved in research, you can get a lot of awards and recognition, and then also you can start to consider different types of careers. So you could maybe consider a career after you graduate in research or even in academia. So that's the end of my presentation, and I hope you were able to get a good understanding about some opportunities that you can take advantage of while you're in dental school. I just really wanted to highlight and kind of give you a more comprehensive understanding about what dental school can be like. Dental school is really about what you make it. It's about your personal experience and growth and journey. I can tell you personally, I didn't think I was going to necessarily go along the path that I'm in right now, but dental school, because of all the opportunities that I was able to take advantage of, it really set me on a path that I'm really quite happy with right now. So if you have any further questions or anything like that, again, I'm going to refer you to the www.godental.org. Unfortunately, I'm not going to be available for chat, but while you're at Godental, you can learn more about the dental specialties. Again, you can learn about what students think about their dental school experience, about the day-to-day activities of a dental student. But also, if there's a topic that you're interested in, you can actually start a blog. If you can start one under Blogistry and ask a question and see what dental students think, see what other pre-dental students think, and see what some of the Adea staff can also, resources that they can provide for you. So again, I'm Dr. Evelyn Lucas-Perry. It was a pleasure talking to you, and again, I congratulate you on considering the field of dentistry.